Kidney stones are hard deposits of material in the body associated with urine and bile in the kidney. Kidney stones are caused by a prolonged high concentration of certain minerals in the urine, usually calcium, oxalate, or urate. A person with a family history of kidney stones may be more likely to develop stones. Other causes of kidney stones include metabolic disorders, chronic urinary infection, high levels of cholesterol, prostate enlargement, narrowed urethra, dehydration, and abnormal pouching of bladder. Kidney stones dam the flow of urine in urinary tract. This obstructs urine flow, which disrupts the urinary system and could potentially lead to loss of function in kidneys. This prevents the proper removal of toxins and waste from the body. Symptoms of kidney stones include sharp and sudden pain in lower abdomen that worsens with movement, weak urine stream, increased frequency of urination, urgency, recurrent urination tract infections, blood in urine. An intravenous pyelogram or IVP involves administering a dye into patient's veins and use of X-rays. High-frequency sound waves or ultrasound can determine if obstruction is present in the kidneys, but will frequently miss stones lodged in the ureters. A computed tomography or CT scan is similar to an IVP but uses advanced computer technology to visualize better all contents of the body. Certain situations may necessitate the use of different tests. Frequently, people with poor renal function cannot receive the X-ray dye because of its potential harmful effects on the kidney. Treatment of any stone depends on the location of the stone, its size, the time it has been in place, and any complicating issues such as infection. Some stones, especially if they are small, cause no pain, and are not significantly obstructing, are given a chance to pass on their own. Extracorporeal shockwave lithotripsy, or ESWL, involves the use of high-energy sound waves created by a machine outside the body and focused through the skin onto the stone. These sound waves break the stone into fine sand, which passes in the urine without symptoms. Endoscopic removal of a stone involves the use of small telescopes passed into the urinary tract, either through the urethra or through the back directly to the kidney. Different means of fragmenting the stone into smaller pieces for direct removal are then employed through the telescopes. These two methods place minimal stress on the elderly patient with other medical problems. Situations like abnormal urinary tract anatomy require open surgery. Laser surgery is another possibility. The pain of kidney stones is excruciating, and though it isn't fatal, prevention is the best way to go. Drink more fluids to keep your urine clean, about 8 to 10 glasses of water per day. This will purify your urine and decrease the concentration of certain minerals like oxalate. You should also change your diet to become healthier, like increasing how much fiber you eat with grain foods. Eat less high-protein products like beef, pork, and poultry. Eat a moderate or high amount of calcium-rich foods. Avoid foods that are high in oxalate. Try not to add salt when you cook or eat. Kidney stones is not a contagious disease, and death is unlikely unless of a complicated and severe case. Most people will be able to get their stone removed safely with no death or further problems. However, the recurrence of kidney stones is greater if you have a previous history. Kidney stones and stones in the urinary tract affect 5 to 10% of the general population of the United States. The likelihood of a person to form a stone for the first time in their life decreases with advancing age. In people who have a previous history of urinary stone formation, however, the incidence of urinary stone disease is similar between geriatric and younger populations.